3 years ago, I noticed that I was getting these lines in my forehead and in between my eyebrows, and I just felt like I looked very tired. I tried Dysport and Botox, and I had excellent results, and I looked really good. I felt like I looked rested. I felt like I looked younger. After the Botox started to wear off, I went back for another series of injections. After a week and a half, I noticed that I had no results. The product didn't work at all. I thought, okay, maybe I'll just try a different doctor. He injected 40 units of Botox into my forehead, and I had immediate flare-ups. And I had these terrible welts all over my forehead for about 4 days. So now I'm like, nothing works. I'm immune. I probably developed a sort of allergic reaction to it. I love the way that I looked with Botox. I thought I looked great. So if I could get that again, I would love that.
That's Marcella, who clearly can't tolerate some common injectables that are used to treat wrinkles. So she joins us with her doctor, board-certified dermatologist, Dr. Billy Groff, who performed a new treatment on her that reportedly can permanently remove wrinkles using heat. You've had this done, right?
Yes.
And are you subjectively happy?
I'm thrilled.
Because I want to show some before and afters before we reveal what Marcella had done.
Wow.
And this is obviously not using the injectables. So Dr. Groff, what did you use?
Well, it's interesting. It's a new procedure called ThermiRase, and when you think about injectables, you think about a needle that enters the skin, okay? Well, think about how wrinkles are created. Wrinkles are created from repetitive muscle interaction with your skin over time. So what we can do with ThermiRase is we can actually trace out the paths of the nerves that cause the muscles to move. And once we know where those nerves are, we can insert this small, it's just a little bit bigger than a needle, under the skin, and then we can actually damage the nerve using radio frequency heat so that it can't function like it normally would. So the muscle doesn't move like it normally would. It's weak, and therefore the wrinkles go away. As you can see in Marcella's photo, it works really, really well.
And it's
amazing.
Considered permanent?
Well, we have patients that are as far out as about 5 years that still don't have any significant movement. Their skin looks nice and smooth like Marcella's, so we'll have to wait and see because permanent's a long time.
How much does something like this cost as compared to some of the more common things that are used?
Sure, that's a great question. You gotta think about, well, if you do Botox, how much do you spend in a year? It could be $1,500, it could be $1,000. This right now, it's about $2,500 to $3,000. So let's say it lasts 3, 4, 5 years, it's a worthy investment.
What do you think, Dr. Gordon?
This is why I love doing the doctors. I learn something every day. I have never seen this type of reaction where you acquired a sensitivity to something, like you said, Billy, one of the proteins in all of the neurotoxins that we inject. So you treated not only the frown lines of glabella here, but you did her forehead as well, correct?
So the frown lines here, and then the frontalis muscle, or the horizontal lines across the forehead, exactly. So you need someone that knows the precise location, they understand the facial anatomy, so this isn't something you're gonna wanna go to a med spa for, absolutely.
That's the point that I'm trying to make.
Plastic surgeons, dermatology offices, people who are, well-versed in these things. Exactly.
Well, I must say, I'm duly impressed. You look great.
Thank you.
Whatever all you three are doing, I'm speechless.